Good day everyone. Again, my name is Sergio and welcome back sa ating channel. And for today's topic, we are going to discuss your community organizing. But before we go to the actual discussion, please don't forget to subscribe to this channel. Please hit that like button and comment na rin po and share these videos to your friends and classmates that are also interested in nursing topics. Okay. For today's video, we are going to discuss community organizing. But before that, I'm going to give you first a review about your community health nursing concept. Since ang community organizing po ay isang umbrella topic under your community health nursing, which is one of the fields of nursing in the Philippines. So let us have some basic concepts about your community health nursing. Community health nursing focuses on the promotion of health of the community and of course the prevention of diseases among its people. And so basically, we want the people to become healthy in a sense that they will not acquire diseases or they will not go to the level wherein they need to be hospitalized. Okay, that's why primary prevention is very basic under the practice of community health nursing because we don't want the community people to become part of those who were confined in the hospital, which will become patient. Okay, as I've said, from our previous discussions, okay, with our videos, the focus of community health nursing is more on prevention, okay, rather than the cure, okay, because curative aspect is already a part of the focus of your hospital nursing, o yung tinatawag nating within hospital field of nursing, okay. Now, aside from that concept, community health nursing also has its primary goal. So the primary goal is basically to enhance the capability of the people. Enhancing the capability of the people means people of the community will become self-reliant. Okay, whenever we community health nurses or other developers in the community or organizers in the community develop a program for the people, we need to consider that community people should be a part, okay, or will become an active participants, okay, in this activity, because at the end of the day we want them to become independent from us, okay, meaning they can stand with minimal or without assistance coming from us. Okay, so at the end of each program we want to achieve a level wherein they can perform it on their own. Okay, so that is what we mean by the primary goal of community health nursing, which is now related to the topic that we are going to discuss today, which is your community organizing. So to start with, let us first define what is community organizing. According to our book, according to the book of Sister Jimenez, okay, which is a book for community organizing, participatory action research, okay, according to her book, community organizing is a continuous and sustained process. So it's a continuous and sustained process. So meaning, since this is a process, there is a step-by-step, okay, activities that we need to follow in order for us to achieve the goal of community organizing. Okay, so what are those steps? Number one, don't forget, by the way, don't forget the mnemonics HOME. Okay, HOME stands for H, which is health education, O for organization, and M for mobilization. So what is the difference between these three processes? For number one, health education. Okay, health education is conducted in the community in order for the community to increase their awareness, okay, about the presence of problem, okay, presence of problem in the community, or to increase their awareness of the people to identify their needs or problems, okay. um According to a lot of researches and of course according to the book, okay, the number one health problem in the community is actually the lack of information. Okay, lack of information, because basically programs are already available for the community's benefit. However, some of the community people are not aware of the existence of this program. I'll give you a very good example. Okay, in the community setting, okay, in the community setting, it is sad to say that your tuberculosis or pulmonary tuberculosis is still among the top 10 causes of mortality and morbidity in the Philippines, not only in the Philippines and even in the world. Okay, this is aside from the fact that there are already existing treatment, okay, diagnostic treatment and interventional treatments available to treat or to cure your tuberculosis. Okay? And in the Philippines alone, okay, libre po ang magpa-check up kung ikaw ay inuubo ng more than 2 weeks. Okay, you are actually allowed to go to the to the health center to have a check up, and free po lahat. X-ray, sputum microscopy, okay? It's free of charge. All you have to do is to go to the health center, have yourself checked by the doctor or by the healthcare professionals in the health center, and they're going to give you an order, and you go directly sa diagnostic center ng inyong municipality. And actually, that's part of the National Tuberculosis Program. And once you are tested positive for tuberculosis, okay, you will also refer to the health center, and the health center will going to give you free medications. So lahat ng antibiotics natin for tuberculosis in the health center is actually free of charge. And this program, or the National Tuberculosis Program, is already existing. Okay? And sad to say that whenever you go to the community, based on my experience din talaga, kapag may narinig kang mga community members, when you ask them, inuubo po kayo? Okay, it's more than ilang linggo na po, matagal-tagal na po. Bakit hindi po kayo nagpapa-check up? Walang pera. Okay, that is commonly the reasons. Wala kaming perang pampa-check up, wala kaming perang pampagamot. Okay, when you tell them that it's free of charge po, punta ka lang ng health center and you will be checked by the doctor, you will be referred to the diagnostic center, you will be checked through x-ray or sputum microscopy, okay, and you will also be given medication if it turned out that you will become tested positive for tuberculosis. But sad to say, kokonti po ang nag-avail ng ganitong program simply because they are not aware. Okay? Another example is that vaccines. Okay? Vaccines that are given in the health center are the same vaccines na binibigay ng mga private hospitals or private clinics or private physicians. And sad na may mga kababayan tayo na hindi nagpapabakuna due to the same reason. Mahal magpabakuna. Okay? Or nagpapabakuna sa private without knowing na parehas din naman yung binibigay na bakuna doon sa ating health center sa ating mga private doctors. Okay? So doon tayo nakakaroon ng problema. And if you try to sum up these problems, okay, it is because of the lack of information. They are not aware of the existence of this program. Okay? Kaya nga tinatawag na lack of information is the number one problem in the community. Okay? Doon po tayo papasok bilang mga nurses. As nurses, our primary responsibility is to provide health education to the community for them to become aware, okay, of the problems and needs, okay, that are present in the community. Okay, basically, we want them to become aware of the existence of this problem. We want them to become aware of the existence of these activities and programs that they can actually get as provided by the government. Okay? And madalas po kasi is hindi aware ang mga tao. Kaya nga, health education is the primary responsibility of nurses. We want to discuss as more as programs to the community as possible. We want them to become informed so that they will be able to decide based on this available information. So once the community is already decided, okay, they already have an idea of what the problem is and the problem is existing, okay, so they will able to identify now this problem and identify solutions regarding this problem. And since our main focus is the entire community itself, okay, kahit aware ng isang pamilya, hindi po tayo titigil doon. Okay, kailangan majority of the community people will become aware of this information that we are actually providing them. So once majority of the community is already aware of this existence ng mga programs na ito, we are now ready to organize them. So organization is basically developing the community's capability as a group and not as individual. Okay, let me go back to the primary responsibility, primary goal of community health nursing. The primary goal is enhancing the capability of the people. Okay, and we want it to enhance their capability as a group, not as individual. Para po sila ay nagtutulungan, there are participation, collaboration, communication among other members of the community, and of course, there are collaboration among its member. So once they are already developed as a group, okay, wherein nagtutulungan na po sila to develop a certain project or program in the community for their own benefit, we are now ready to mobilize them. So mobilization is basically involving the people into action. Involving the people into action means that they need to participate. We have to oblige them to actively participate in each programs that we are developing. Why? Because we want them to develop their capability as humans, as people. Kasi nga at the end of the day, we want them to become self-reliant community. And once we already observe that the community is already self-reliant, they have already achieved yung tinatawag nating independence, okay? Not only from the government, but also from other outside organizations, okay? It means to say that we will now be able to achieve the end goal of community organizing, which is your community development. And community development will then lead to a better quality of life. A better quality of life. And according to our book, community development is an organized effort, as you can see there, organized effort of the people to improve the conditions of community life and the capacity of the people for participation. Kaya paulit-ulit ko pong sinasabi, participation, collaboration, communication among community people is very important. Until such time that they'll be able to achieve yung tinatawag nating self-direction or self-reliance, okay, and integrated efforts in community affairs. So basically, we will be able to achieve now the primary goal of community health nursing, which is your self reliance or enhancing the capability people as an end product of your community organizing. Okay, so that is your community organizing. So regarding your community organizing, there are three approaches that we can use in order to implement your community organizing. So these three approaches are the following. So let's start with the first one. Okay, number one is your dole-out approach. Your dole-out approach, according to our book, is also known as your welfare approach. Okay, welfare approach. So welfare approach. So this is basically the spontaneous amelioration of the community needs. So tayo na po as an outsider, as a nurse, tayo na po yung nag-aalis ng problema nila or nagbibigay ng solusyon sa kanilang problema. Okay? So, but the thing is, if we keep on using this dole-out approach, okay, magkakaroon po ng problema because it can promote your dependence, okay? It can promote your dependence, okay? Very common po sa Pilipinas ito kasi nga kadalasan yung approach ng ating mga government officials and even the government itself is more on the dole-out, okay? More on the dole-out. I'll give you a very good example, okay? Since election po next year, makakarinig na naman po tayo ng mga promises from our election or from our politicians na pag ako nanalo, magkakaroon kayo ng libreng bahay, libreng pagkain, magkakaroon ng libreng allowance, okay, o magkakaroon ng allowance, libreng hospitalization, libreng pag-aaral, libre lahat. Okay, we are not against those three things. Okay, hindi pa tayo against them kasi nga nagbabayad nga naman tayo ng mga tax and everything. However, kung ang approach po kasi natin lagi is that, Mayor, wala akong pera, bigyan mo akong pera. Since gusto ni Mayor ang boto mo, bigyan kang pera. Mayor, wala kaming matirahan, kailangan relocation. Since gusto ni Mayor ang boto mo, bigyan ka ng bahay. So kung ano yung gusto mo, binibigay ni Mayor. Kasi nga, kailangan niya yung boto mo. Okay? Ang problema doon, sa tuwing naghihirap na yung tao, yung pamilya, alam niyang meron siyang maaasahan. Alam niyang meron siyang lalapitan. Okay? Kasi if that's the case, okay, tendency, tatama rin na ang taong magtrabaho. Kasi nga, in-expect niya na meron siyang tatanggapin buwan-buwan. Okay, I'll give you a very good example na medyo dole out talaga ang approach, though this department is actually trying to defend it na hindi naman daw siya dole out lang kasi may good benefits naman makukuha. Yes, nandun na po tayo, but it doesn't disregard the fact na ang process na yon or ang programa na yon is dole out. Okay, alam ko pamilya kayo dito, which is your 4Ps, your Pantawid Pamilya Pilipino program. So your 4Ps program is actually a program wherein monthly nakaka-receive ng allowance, rice allowance, kung di ako nagkakamali, allowance for each of the children, okay? Yung isang pamilya na may 18 years old and below na pamilya, maximum of 3 children pwede makatanggap, plus the parents will also receive allowance, okay? Ang requirement lang dapat is dapat ma-send nila, okay, yung anak nila into school, na dapat hindi liliban yung anak niya dun sa school, na dapat suportahan nila mag-aral. Okay, the intention is good. Okay, the intention is good. However, if we try to analyze the program, it's actually a dole out. Okay, because in the first place, it is the responsibility of the parents to send their kids to school. Hindi po responsibilidad ng gobyerno na bigyan ka ng pera para yung anak mo ay pag-aralin mo. Kasi in the first place, dapat ikaw talaga ang magpaaral bilang magulang. Okay. Baka sabihin po ng iba, yes sir, paano pag hirap na hirap talaga yung pamilya? Wala namang magawa. Okay. Yes, siguro tatanggapin natin yun. Okay, since the family is really poor, included sa poorest among the poorest. Okay. But the thing is, we have to accept the fact also na marami pong 4-piece member ang hindi naman talaga deserving. Okay. And bilang isang middle income earners, which are also taxpayers, okay, nakakalungkot isipin or nakakainis na makita na yung mga taong tumatanggap ng taxes from the government, ng suporta from the government, is actually spending it not wisely. Okay, ini-spend nila yun ng bara-bara na lang. For example, alam kong nakita na kayo once in your life, 4-piece member, laman ng inuman, laman ng sugalan, okay, laman ng mga sabungan, okay. Last year lang, 2020, when this pandemic happens, the government provided an ayuda. Okay? Depende sa mga provinces mo or region mo, you can receive about 5,000 to 8,000 pesos. I have watched news wherein in-interview yung isang nakareceive from Manila po. Nakareceive siya ng 8,000 pesos. Okay, if you try to research it in YouTube, makikita nyo po yun. Tinanong siya ng reporter, ang sabi ng reporter, sa tingin nyo po ba ay kakasya or enough po yung 8,000 na ayuda nyo na na-receive nyo? Okay? Sumagot itong babae, sabi niya, kulang po yun, 8,000. Baka nga po isang linggo lang yun. Sabi po ng babae, imagine, poorest of the poor yun, okay? Sabi niya, kulang daw yung 8,000 na tinanggap niyang ayuda, baka isang linggo lang. Yung mga middle income earners natin nagsasahod ng 8 to 10,000, yun yung allowance nila sa isang buwan. Okay? Kasi nga, ang mga taong ito, ang kadalasan nakaka-receive ng mga dole-out programs from the government. Okay? Sila yung mga nakaka-receive ng maraming free sa government. At na-inculcate na sa mind nila na ang gobyerno natin ang may responsibilidad na buhayin sila. Kaya tendency, nagtatamad-tamaran, hindi nagtatrabaho. So, nagre-receive. Okay, pero nagre-receive pa rin ng ayuda sa gobyerno. Okay, nakakalungkot pa nga nung na-receive nila yung mga ayuda nila. Okay, last year, saan sila nahuli? O, saan sila nakita? Nahuli silang nakikipagsugalan, okay, nakikipagsabong, okay, pinambibili ng alak, at worse, yung iba pinambili pa ng droga. Okay, yun. Siguro kung may mga dapat mambaguhin sa program yun, siguro yung selection process, okay, selection process na dapat magkaroon sila ng criteria kung sino yung mga talagang kukunin. Siguro may criteria siguro, pero sana magkaroon din nung criteria kung sino dapat yung tanggalin. Okay, na agad-agad kapag nag-violate. Like for example, binili ng droga, okay, dapat tanggalin na agad. Nakita mo, nahuli mo, ni-report, nakitang nakikipag-inuman, ginamit yung ayuda, ginamit yung natanggap buwan-buwan, dapat tanggalin na sa programa. Kasi marami nga naman pong families na are actually should be the beneficiaries of this program, okay? And nakakalungkot na marami po yung hindi deserving. Okay, hindi deserving. So if you do agree with my sentiments about these programs, kindly please comment it down po sa ating chat box naman or sa ating comment section so that we can have a healthy discussion about it. And since dole out is basically promoting dependence and in relation sa ating primary goal, which is dapat mag-promote tayo ng self-reliance, this is considered as a worst approach or the worst approach. Hindi po siya magandang approach. Kasi nga, okay, kinakalaban niya yung ating primary goal, which is enhancing the capability of the people. Okay, maririnig niyo yan. Lalo ngayon, by next year election. So sana pag bumoto tayo ng mga politicians na ang programa is malinaw. Yung mga politicians na talagang may plan kung paano paunlarin ang buhay natin. Hindi lang yung mga politicians na pag ako nanalo, bigyan kita ng bahay, bigyan kita ng ayuda, bigyan kita. Kasi in the end, tayo din ang maghihirap. Hindi po abang buhay magkakaroon ng stable economy ang ating gobyerno. Paano pag bumagsak? Pag bumagsak po yan at nakaasa tayo sa kanila, kasama tayong mabagsak. Okay, another one is your modernization approach. Your modernization approach is also known as your Western approach. So, Western approach. Tinawag po siyang Western approach kasi nga, kadalasan po, when we talk about modernization, this is basically adapting to whatever new trends is out there. Okay? And kadalasan, itong mga new trends na to, nanggagaling po sa mga Western countries like the USA, Canada, and the UK. Okay, or Europe. Okay, so doon po nanggagaling yung mga new trends na tinatawag. And we adapt to that. And it's good. Okay, maganda po ang pag-adapt sa mga new trends. There's actually a good thing about it because in some cases, it promotes good condition to the entire community. The best example of this is the weaving industries in Sagada. So in Sagada, okay, they are very known for their weaving industries. Okay, yung mga nagahabi ng mga tela, magagandang tela, which is traditional clothes, traditional fabric ng ating mga katutubo in the Cordillera. Okay? And this actually made by the housewives, yung mga kababaihan doon sa community. And it provides job, it provides income for the community. Okay, ngayon, since, for example, may pumuntang enterprises doon sa Sagada and they want to improve this production, okay? So, gusto nilang magkaroon ng mas marami pang production ng ganitong weaving products, okay? So, what they did is they bought machineries that will do the job for the people. So basically, yung machine na ang gagawa ng trabaho. And it's a good thing kasi nga tataas yung production. But the thing is, kapag tumaas nga ang production, pero ang gumagawa na ng trabaho is the machine. So nawawalan ng trabaho yung mga tao ng community. And we don't want that to happen. Kasi nga, we want to create jobs. Okay, we want to create an additional income to the community. So inserting a modernization approach and leaving or forgetting the local innovativeness or the local customs in the community is not good. Okay, dapat when we try to adapt to modernization, we have to incorporate it to what is existing. Okay, to what is existing so that we can maintain yung production and at the same time the job for the people. Kasi we want to enhance their capability. Paano mai-enhance yung capability nila kung gumamit ka ng machine, nawalan sila ng trabaho. So this can be a positive and at the same time a negative approach. Okay? A positive and a negative approach. And the last one is your participatory approach. So participatory approach is also known as your transformatory approach. Okay, tinawag siyang transformatory approach. So basically kasi when we try to choose a community, the community are actually depressed, oppressed, poor, exploited, and struggling. Okay, that's why we chose that community, the poorest of the poor. Okay, and we want that the community to change for the better. Okay, so itatransform natin sila from that type of community to become a developed community. Kaya tinatawag natin siyang transformatory approach. And how are we going to do that? Through participation. Kaya kung titignan natin kanina yung definition ng ating community organizing, it is a sustained process of what? Nandun yung organization, okay, which is developing the capability as a group. Okay, developing their capability as a group is working together, which is a participative approach. And of course, we want to mobilize them, okay, involve them into action. Kailangan may active participation among the community member in order for us to achieve the end goal of community organizing, which is your community development. And once the community is already developed, it may lead to a better quality of life. That is why your participatory approach is considered as the best approach. Okay, the best approach among the three approaches of community organizing. Okay, now to summarize all the discussions that we have about your community organizing, again, community organizing is in line with the primary goal of community health nursing, which is the enhancing the capability of the people or self-reliance or independence. dependence. Okay, so this is a community organizing is a sustained and continuous process of number one, health education conducted by the nurse, which is their primary responsibility. And we are doing your health education to increase the awareness of the people for them to identify their own needs and problems. Once they are already aware of the existence of the problem, we are now ready to organize them. And when we organize them, we have to organize them as a group, not as an individual. There should be collaboration, participation, communication among the community members. Once they are already organized, we are now ready to mobilize them. Mobilization means involving the people into action. The people of the community should have an active participation in whatever programs or activities you develop together with them. Once you already did, okay, or done with these three processes, you will now be able to achieve the end goal of community organizing, which is community development. And community development will lead to a better quality of life among the community people. So that is basically your community organizing. At the end of this process, we want the people to become independent, self-reliant, and can work on their own even without or with minimal assistance from the government or outside agencies. So that would be all. Again, please don't forget to subscribe to our channel. Please hit the like button, comment po sa ating chat box if you do have questions and suggestions, plus share this to your classmates and friends. Okay, thank you once again and bye for now. See you on my next video.